Hi, welcome. I'm Dr Khaled Sadek and you're watching my channel, Dr Khaled Sadek Uncut. In this channel, we're going to be discussing a broad church of medical topics, also complementing my Lipoma Cyst website as well and YouTube channel. So you may be familiar with our surgery on lipomas and cyst removals, and here we're going to be discussing a bit about what happens backstage when we film that, a bit of information about how lipomas and cysts form, how we treat them, and so forth. So let's start by first of all introducing how we go about treating and also managing the growths like lipomas. So lipomas are a benign fatty growth. That is to say, they're not cancerous. What you get, instead of layers of fat being laid down underneath the skin, you get a collection of fat balled up together, and it causes this lump and it distorts the skin, and it can be quite unpleasant one to look at, and it can be painful. Some patients also tell me that they feel a bit cold in chilly weather at the lipoma site as well. Typically, if they're under 5 centimeters, it's pretty benign, but they can grow in size and it causes more distress. But more importantly, some of the cells can turn into cancerous cells like a liposarcoma. And so you should be aware that you shouldn't let them grow for too long. Typically, we remove these under local anesthetic. We use a special mix of 2% xylocaine, so it's got a bit of adrenaline and a bit of the lidocaine in there as well. And the adrenaline is there to really stop the blood vessels. What you notice from our videos is that the blood caused by the incision on the skin is minimal, and that's because we constrict those blood vessels to give us much better visual field. Now, the risks involved with minor surgery that you see on our channel are exactly the same kind of risks you might get with much more general anesthetic surgery. So typically pain, when we put the anesthetic in, that hurts a little bit. It's a bit like a bee stinging, but it disappears very quickly. And when it starts to work, you won't feel any pain during the procedure itself. We make a small cut into the skin, so invariably bleeding and bruising is a risk, and that can happen both during the procedure and after the procedure, so that when you go home, you might notice some bleeding through the dressing as well. Now, because the skin is cut, there's a risk of wound infection. Now, we obviously clean the skin, we drape it with sterile equipment and drapes, and we also warn patients of that it could be a risk. It's a very low risk, and touch wood, we don't get very many of those. Now, of course, when you cut the skin, there's a risk of scarring. Now, that will depend on a number of factors. Number one, whether or not there's been an infection of the wound. Number two, the size of the wound. And number three, the kind of material, suture material, and the type of stitching used as well. Also, certain skin types are prone to different kinds of scarring, like keloid scarring, for instance. So that being said, often we get really good results with very small incisions and able to remove these lipomas and get a good satisfaction for our customers. Now, lipomas can be classed really in two types, and that's from my experience as a surgeon who performs these procedures all year round. And you get the simple type, and that's a little more like a cherry tomato, and you make a small incision, you squeeze it, and the thing comes out whole, and you can put a stitch in, and there's no problem. You get a second type, which is more like a lipomata, and you can imagine those like a bunch of grapes. That's to say, you've got a large bunch of tissue, and then you've got a smaller tapering out seedling of grapes. Now, those are slightly more problematic because there's a risk that some of those seedlings at the base of the grapes can remain inside the tissue and cause reoccurrence. That's meaning it'll grow back slowly over time. You may have seen some of my videos where we've talked about patients who've had liposuction in the past, and they've come back in to see me 5-10 years later to have corrections on the growth of the lipoma. You tend to get that a lot more with liposuction because it's kind of a bit of a blind way of removing the tissue than if you were to excise it precisely in front of your eyes. Now, with cysts, I think you've heard me describe cysts as being these encapsulated glands that produce oil and nutrition to keep the skin healthy. But they can, of course, cause disease. And the most common types are epidermoid cysts, pilar cysts, where you get a follicle or a gland that becomes blocked but keeps growing and growing and growing. Unless it is painful, it typically just causes a discomfort in terms of the way it appears. If it's a pilar cyst in the scalp, it can result in hair loss on the scalp as well. I always say they all need to come out because the worst thing that can happen to a cyst is that it becomes infected. You can think of this oil like being a very calorie-rich nutritional material where bacteria would love to get in there and just feast on that oil. And what happens is the whole thing just blows up. In one of my videos, I've described how you can think of cysts like a balloon. If you get a balloon and you blow it up and you fill it up with foam, that's a cyst. You've got that balloon and it's shaking around inside. Now, what happens when an infection comes on is the bacteria break that encapsulation. And that's like getting a pin to that balloon and the whole of the rubber just vaporizes and it goes everywhere. And you get gunk coming out of the skin, dispersing into the surface of the skin, and there's a lot of swelling and pain, and it doesn't look nice. In these instances, it's very difficult to just close the skin and be done with it. The skin does not heal if it's infected. Now, it's important to realize that there is a bit of science behind how we manage the different types of cysts and the closure of the skin. Mother Nature has a way of healing which you are all familiar with, and that is if you cut yourself, you have a scab, and the skin heals from the top down. This is called primary intention. We always like to give nice names to medical, to Mother Nature's progress. Now, this is the best way of healing a wound because it's very quick, it's very easy to manage. However, if the skin's infected, you can't just close up the skin because it won't take and it'll just keep opening up and you'll be left with an abscess, a collection, a bacterial reservoir under the skin. So in those cases, what we need to do is we get a special ribbon that's impregnated with silver and we pack it. So you might have heard me say to some of my patients that the wound's infected and we need to pack it. And that basically allows the healing to happen from the base up. So that's not closing from the top going down, it's coming up from the bottom up. And as you'd imagine, that takes much longer and the packing needs to happen every day, every other day. So patients really need to be cooperative in terms of managing this cyst and making sure that the infection is treated well, doesn't come back again. But recurrence is always a risk. And typically it happens when the sac isn't removed in its entirety, and a lot of you are more than aware of that. With infected cysts, however, because that balloon rubber just vaporized everywhere, it's very difficult to go and pick up individual pieces. But the packing helps to bring it all to the surface so that it isn't encapsulated and goes back. But it's always a risk, so reoccurrence is a risk. You may also have seen us use some of the curettes. That's to say we kind of scoop out any debris or muck that's inside using a circular blade. A bit like an ice cream vendor might give you. A scoop of ice cream, we kind of scoop out the inside of the cysts as well. So now that we've got our cyst or lipoma out, we need to close the skin. Sometimes if it's a big and deep cavity, then it's important to close some of the layers underneath the skin individually. In those instances, what I do is an interrupted single dissolvable stitch. And that just helps to bring in the cavity so that you don't have like a defect or any sort of collapse in the wound itself. And then it's a matter of closing the skin. And you've seen in my videos that we use very small incisions because I feel that for the patient, having the minimal scar is really, really important. So we use very, very small incision. If the incision is 1 centimeter, 2 centimeters, then I'll just place some interrupted stitches. You've seen me do those. If it's a slightly bigger incision, what I tend to use is a non-dissolvable subcutaneous stitch. That means the stitch goes underneath the layers of the skin and you can't see it, and it just brings it back nice and neat so that there's a much better scar and it looks better for the patients as well. Typically, the non-dissolvable stitch comes out after 7 to 10 days, and I always recommend that patients keep the wound dry for about 42, 48 hours after the procedure. So, I hope you found that really useful. If you have any questions about anything you've seen on Dr. Khaled Sadek's pimple popping website, do let me know down below and we can discuss it in the more educational field. If there's any medical topics you want to discuss, again, let me know down below and I'll happily take a look at that. So we couldn't do this without your support, so don't forget to share, like, comment, subscribe, press the alert button, follow us on Twitter and Instagram. So with no further delay, make sure you get yourself onto the other channel because we're going to be releasing this fantastic cyst on the face. So enjoy it. Till next time, bye bye.